all here, or at least be with you all here. I can see a few of you. It's Marcin, I would ask if you give your usual introduction and then we can get started.
Yes, Mr. Chair. This meeting is being recorded for minute-taking purposes, as well as for posting of the recordings of the proceedings on the agency's website. Connecticut Television Network, CTN, is broadcasting this meeting, and this meeting is also being live-streamed on the Access Health CT website. It is requested that participants introduce themselves every time they speak. Roll call votes will be taken for every action item. Mr. Chair, would you like me to do the roll call vote for attendance?
Please do. And
Thank you.
I think I'm the top of the list, so this is Charlie Klippel, present.
Thank you, Mr. Chair. Paul Philpott?
Here.
Ron Rader?
Here.
DJ Gifford? Steven Hernandez? Matthew Brockman? Thomas McNeil?
Here.
Thank you. Dina Berlin?
Here.
Thank you. Andrea Barton Reeves, DSS Commissioner? Kathleen Holt from OHA?
Here.
Thank you. Claudia Gualtieri from OPM?
Here.
Thank you. Tricia Day from Connecticut Insurance Department?
I'm here.
Thank you. Manish Tutani, DPH Commissioner? And Carlene Zambetti, designee for Nancy Navarrete, DMS Commissioner. Thank you.
Hey, Marcin, Matt Brockman, I'm here. I think I missed my.
Thank you.
It's my
Thank you, Mr.
moment.
Brockman. Okay, sounds good. Thank you, Mr. Brockman.
Thanks, everyone.
Sorry, this is Manisha Chutani.
Thank you, Commissioner. Appreciate it.
Oh, very good. So we have more than a quorum. It's fantastic. Great to see you all. James, if you would start the introductions of the Access Health team that are on the call.
Sure. Good morning, all. James Michelle, Access Health Connecticut.
Gina Walsh, Director of Operations, Access Health Connecticut.
Rebecca McClear, Access Health CT, Director of Technical Operations and Analytics.
Good morning, Susan Rich-By, Director of Legal and Governmental Affairs, Access Health CT.
Good morning, Caroline Ruette, Director of Marketing, Access Health CT.
Good morning, Glenn Jurgen, Director of Human Resources, Access Health CT.
Good morning, Tammy Hendricks, Director of Health Equity and Outreach, Access Health CT.
Good morning, Marquise Davis, Director of IT, Access Health CT.
I think that concludes everybody. I was hoping Holly should be on, but she's not on right now. Let me check, make sure she's okay.
Okay. In the meantime, thank you all for joining us today. I understand from Marcin we have no public comment today. I'll make one semi-public comment, which is to congratulate our CEO and as well as Dr. Jutani on being very recently nominated among the power players, the 25 power players of Connecticut by the Hartford Business Journal. So, congratulations to the two of you. We need that power on this team, so we appreciate your contributions for sure. Thank you so much. Next item, I would ask for any comments on the minutes from the last meeting. Does anybody have any comments or corrections to those minutes? If not, I would ask for a motion to approve the minutes.
Mr. Chair, this is Claudio. So moved.
Thanks, Claudio. And a second, I heard.
Tom McNeil, second.
Thank you, Tom. Again, any questions or comments? If not, Charlie Klippel, I have to abstain on this one because I wasn't at our last meeting. So with thanks to Paul Philpott for filling in, I abstain.
Thank you, Mr. Chair. Paul Philpott?
Yes.
Ron Rader?
Yes.
DJ Gifford? Steven Hernandez? Matthew Brockman?
Abstain.
Thomas McNeil?
Yes.
Dina Berlin? Ms.
Yes.
Berlin? Thank you. Andrea
Yes.
Barton Reeves? Thank you. Kathleen Holt?
Yes, thank you.
And Claudio Galtieri?
Yes.
Thank you. Motion passes.
Thank you all very much. James, the floor is yours for your CEO report.
Thank you, Mr. Chairman, and thank you for the for your kind words. Good morning, all. My name is James Michelle. Welcome to our November board meeting. I'm the CEO for Access Health Connecticut. Before I start, I do want to introduce Tricia Davey. Tricia, she is the Assistant Deputy Commissioner. She's also a Director of Life and Health in the Insurance Department. She is replacing Paul Lombardo, who retired earlier in the summer. Tricia, welcome to the team. We look forward to your noteworthy contribution. Before we begin, I wanted to share that we are monitoring what is happening in DC regarding the expiration of the enhanced premium tax credits. I recently sent the board a memo outlining our strategy for multiple scenarios, including the extension of the enhanced premium tax credits whenever they happen, whether they happen in January, December, or February, but we are ready to pivot one way or the other. And again, November, December, January extension requires us to do different types of work, and we are exploring the possibility of if we need to expand open enrollment beyond January 15th. So all those are on the table to give our customers maximum possibilities to maximize the enhanced tax credits should they be extended. We will keep you up to date with any new impacts, with any news that impact our customers and Access Health Connecticut. I also wanted to report that I visited our 6 Navigator locations at the beginning of open enrollment. It was very rewarding to connect with them and hear their stories regarding the recent federal changes and how that's impacting their ability to service their clients. These locations are focused on helping their communities, and we are fortunate to have them as our partners. Our meeting this morning will begin with a presentation of the fiscal year 2025, the 2025 year-end budget report by Holly Zwick, Director of Finance. In addition, Holly will share the investment report for fiscal year 2025 and the first quarter for fiscal year 2026. She will also share the fiscal year 2026 first quarter budget report. These items were presented to the Finance Committee last week. Following Holly will be Susan Richby, Director of Legal and Government Affairs. She will present summaries of the fiscal year 2025 financial and programmatic audits for your approval. In addition, she will give a summary of the state-based marketplace annual reporting tool, which is the CMS requirement for us to report to them how we are doing. And we were submitted on time, but we have not heard from them simply because they were in a shutdown mode. Following Susan will be Katie Hearn, Associate Director of our Enterprise Project Management Office. She will give you an open enrollment update. Thus far, our numbers are trending better than last year for the same period. Right? That's a testament to the amount of communication that we've been doing since July about what's coming. I think that it's helped our customers to prepare for all the changes that they're seeing on our website. We are off to a strong start with our enrollment numbers higher than what we expected in the first weeks. If time permits, Susan will give you an update on the Affordable Care Act and again the lawsuits and the impact that's having across the country. Thank you again for attending to this meeting. I will now pause for any questions if there are any. Thank you.
Thank you, James. Any questions? Claudio?
Yes, thank you, Mr. Chair. This is Claudio. I just wanted to revisit a topic that you all brought up, I think last time we met, about trying to make sure that to manage all the disruption that may be happening in the exchange, that Access Health intends to maybe bring on a couple independent paid-for brokers to help people navigate and get connected to health insurance. I wanted to flag a recent development that I was made aware of related to one of the carriers. And I thought it was interesting, and I don't know if there's any levers that Access Health can play to make this more of a process broader than just the Anthem carriers. But Anthem has announced that they're going to pay extra bonus commissions to brokers if they attribute to a primary care provider and if their enrollee ends up getting a preventative screening exam. And I thought this was really interesting because with the work of the cost growth benchmark, we've tried to promote and have a 10% target for primary care spend, believing that the more we can invest in upstream primary care, the better that will be for total overall healthcare spend. And so my first question is, one, would we consider establishing a similar bonus structure for the two brokers or few brokers that we're bringing on to Access Health CT as employees? If I would strongly suggest we do. And two, can we make this a standard practice and require it across any carrier that's offering? So that would mean extending it to Molina by way of regulation or rules that Access Health has.
Claudia, thank you for that question. We have to look at that and get back to the board, but we don't do anything with commissions and payment to brokers. That's between the carriers and the insurance department. But I think that we may have some flexibility and when we are designing our plans going forward, particularly 2027 plans. I think that that's one area when HPBQ is looking at plans for 2027. Then I think that's when we could look at that because as you know, all the premiums have been approved, and any additional costs introduced by us now would be going forward, not for 2026. But that is something that we will look at, and how do we encourage the carriers all carriers to have a similar program in place. But again, that's something we would have to work very closely with the insurance department, and especially adding more cost to the carriers. Susan, I don't know if you have anything else you want to add to that, but typically, Claudia, we don't do anything at all with respect to how carriers interact with the brokers.
Yeah, no, James, I think.
Sorry.
I was going to just say, I think with respect to the few that we're hiring directly as Access Health CT, it may be nice to mirror that same bonus structure, knowing they're getting paid a salary, but perhaps on top of the salary, performance-based bonuses, mirroring this incentive to try to encourage people to attribute to a primary care provider and get a preventative screening exam within the planned year. I thought that could be something we can put the data.
Absolutely,
because we're doing it.
That is something, Claudia, we could certainly explore with them. Again, I want to reinforce they're not our employees. They're going to be contractors to us. But whether they're contractors or employees, that's an incentive we could put into the agreement we have with each one of them, where they encourage anyone that's enrolling through them to get a primary care and also get a physical. Again, that's something we've been advocating directly, but that's something that we certainly could put into in the contract between us and the carriers, in the brokers that we are going to contract with. So we will do that, Claudia, and get back to you on that, okay? Go ahead, Susan.
Oh, sorry. All I was just going to add is as James mentioned, we don't, the commission contract between the carrier and the broker is their own contract. We're not a part of that. The requirements that the board adopted several years ago were that carriers do pay commissions for on-exchange assistance, and that it has to be similar what they pay for on-exchange versus off-exchange. So if the board wanted to consider something else, we can research, and that would be for the board to consider. And to James's point, obviously, everything is rates and everything are all set for this coming year. And the brokers that we're planning on contracting with would not be replacing the other certified independent brokers that are already certified in the marketplace, who have existing relationships with clients as well.
But Claudia, to your point, Claudia, the ones that will be contracted by us, we will put that into the contract between us and them. It plans to hire 8 of them and keep 2 year round, but the other, all 8 will be throughout open enrollment until the end of January. And again, people come into it, and the part of their job is to make sure people see a doctor first of all, they have a doctor, number one, and they see the doctor for preventative physical within the first 3 months of enrolling with them. So we'll work out the details and get back to you on that. But that is certainly something that we want to do. We should be doing. We will put it in with the broker contracts that we have control over.
That sounds great. Thank you, James, and thank you, Susan. Look forward to taking offline whether the board may want to revisit a policy for 27 that makes this more widely applicable. But I appreciate, James, your attention to trying to do it with the tools that we have with the contracted brokers. Thank you.
It's a great incentive. So we should think about, if not the brokers, we can even do it in plan design, but some way or another, I think it's great incentive. So thanks for the question, Claudio, and thanks for the response, Susan and James. Any other questions?
Hey, Charlie, it's Paul.
Hi. Paul, please.
You know, we had something of a discussion last meeting about the cost of healthcare, the increase in cost of healthcare. And I'd just like to mention one thing, and that is that, at least from what I've read in the literature and some experience I've had in the industry, when you have people who select a primary care physician and they then take a preventative physical exam, that cohort's going to have a lower cost of healthcare than the cohort that doesn't do this. So anything we can do that's bending the curve down a little bit in terms of cost of healthcare is worthwhile exercise.
I completely agree. I think it's standard practice for most large employers to provide incentives for those kinds of physicals, and even to provide incentives for having a primary care physician. So I 100% agree with the thinking that this would help to lower costs. So great to think about it, and Claudio, great to remind us about it today. Thank you. Other questions for James? If not, then Holly Zwick, the floor is yours.
Thank you, Chairman Klippel. Good morning, everyone. Holly Zwick, Director of Finance, Access Health CT. Hope all is well. Apologies for my earlier technical difficulties. Again, thank you, Chairman Klippel, members of the board. Today, I will be presenting the fiscal year 25 budget report, the fiscal year Q1 budget outlook, and an update on the reserve fund balance. We presented the fiscal year 26 Q1 budget to the Finance Committee this past Thursday, and it was unanimously approved. Next slide, please. Let's see, agenda, and next slide, Marching. Thank you. This slide provides a summary comparison of the fiscal year 25 budgeted versus actual expenditures. Access Health concluded fiscal year 25 approximately $558,000 under budget, and our shared budget with the Department of Social Services, which I'll refer to as DSS from now on, closed netting approximately $132,000 under budget. Next slide, please. Let's take a closer look at the revenue and expense performance for fiscal year 25. Revenue exceeded projections by approximately $236,000, largely driven by stable interest rates over the past 12 months. Expenses came in, as I mentioned previously, $558,000 below budget. Key areas of savings included $122,000 savings in temporary staffing, savings in media buying, IT audits, and 1095 staffing, all under the contractual services line. These contractual savings were partially offset by increased spending in IT enhancements, specifically related to the development of the ICRA and SHOP platforms. Although these initiatives were originally budgeted under contractual services, our timeline and when development happened necessitated reallocating funds to IT enhancements. We also saw modest savings from rent prepayment and staff training under the other administrative costs line item. And we also saw some savings in supplies and travel due to continued cost-conscious efforts in that area. Okay. Next slide, please. This brings us to our investment report. The total interest earned on the STIF account for fiscal year 25 is approximately $1.3 million, which is an average of $108,000 monthly. It's important to note that Access Health CT's investment portfolio is in compliance with our investment policy, and we can meet our expenditure requirements for the next 9 months. To enhance the security of our financial assets, we have implemented additional safeguards, including a sweep account and positive pay fraud protection. The income generated through the sweep account has effectively offset the associated costs of these protective measures. Any questions on the fiscal year 25 wrap up? Okay, next slide, please. Moving on to the fiscal year 26 quarter one budget, running from July 1st of 2025 through September 30th of 2025. As usual, we are focused on investments in IT, cybersecurity, and health disparities to aid in supporting our mission of decreasing the number of uninsured residents, improving the quality of healthcare, and reducing health disparities. Next slide, please. This slide presents a high-level summary of the fiscal year 26 year-to-date budget versus actuals as of September 30th, 2025, which, as mentioned previously, would mark the end of quarter one. The Access Health CT budget is currently tracking approximately $402,000 under budget. Similarly, the DSS shared cost budget reflects a favorable variance of about $413,000. I'll provide further detail on these variances in the next slide. Here we take a closer look at the quarter one budget versus actuals. As noted, interest income has exceeded projections by nearly $160,000, driven by stable interest rates and carrier assessment prepayments. Additionally, marketplace assessment revenues are approximately $23,500 over budget, primarily due to adjustments related to dental amendments. On the expenditure side, several variances are attributable to the timing of project execution and invoicing. Some initiatives commenced earlier or later than originally forecasted, but we anticipated they will align with budget expectations by year end. Next slide, please. At this point, we are not anticipating any changes to the current proposed budget as of the first quarter of fiscal year 26. Slide, please. This slide provides a comprehensive view of the full fiscal year 26 budget following quarter one. Currently, no changes are expected. However, should any adjustments become necessary, we will return to the Board and Finance Committee to seek approval for any revisions. Next slide, please. Additionally, we are not anticipating any changes to the shared cost budget with DSS at this time. Any questions on the fiscal year 26 quarter one end? Okay.
I do have a question for you. What are you assuming about the subsidy cliff? Are you assuming in this budget that it falls away, or that it or is there a contingency in here if it gets re-upped in January, say?
So, Charlie, there are two areas that, again, the plan we sent to the board spoke to two actions we would take. Actually, multiple actions. Number one is the communication. If they extend them in December, the amount of communication we would have to do will go up dramatically, because we have to folks who have already purchased plans, got the first bill, paid the bill. We have to go back and look at them. Did they purchase down because the subsidy was a lot less than before? Then we have to tell them, our subsidy is back in place, come back in, and maybe buy something more that provides more coverage for them and their families. So the amount of communication will be much larger than what we've been doing. So that's an area that we will have to spend more money on, and that all forms: printing, mailing, email, text, and so forth. So that'll be a little bit more money on that. We may do some TV ads, quick TV ads, so quick, very targeted online, to get people to come back and purchase coverage that's maybe more appropriate for them and their families, more affordable. And that's one area. The other area, so we're going to leverage our brokers to do direct outreach to customers. Again, we go through our system, identify who this impact most, And we'll call them, we'll text them, we'll email them, and we'll send them letters. Then come back and maybe buy something higher. Then there's also system adjustments. We would have to tweak our system to reflect the new APTCs. And there's the sharing data with the carriers. Updating data. So there's a lot we have to do. But again, we have a plan in place on the shelf, ready to execute once we shift. We don't know how much it's going to cost. We've priced it out. We have a general idea. So the impact, we would have to come back to the finance committee and board in April, if there are any financial impact, for us to take money out of reserve if necessary.
Yeah.
But at this point, the impact would, the only impact we haven't focused on right now is the brokers that we have to, as Claudia mentioned earlier, we're going to hire 8 brokers to help support our customers because one of the carriers is not paying any commission at all for first year for new policies.
Right.
So we're gonna backfill that with our 8 brokers, and we're gonna keep 2 of them on our year round. And that's the group of brokers that we're gonna contract with, and then ask them to do part of their contract is to do what Claudia has proposed to us. So we do have a comprehensive plan. The impact to the budget should be minimal, other than hiring new brokers.
Okay. Well, thanks very much. No, I appreciate that. I'm sorry to interrupt.
Okay, to conclude, I'd like to provide a brief update on the reserve fund. As of June 30th, 2025, the reserve fund balance stood at approximately $24.7 million. Once we adjust down for the fiscal year 26 assessment prepayments, which total roughly $1.35 million, and account on the next line item for the $3.1 million in committed projects, our projected fiscal year 26 year-end balance totals approximately $20.2 million. Based on the current fiscal year 26 budget, this equates to about 5.8 months of operating funding coverage. Even though the reserves have increased since last year, expenses have increased at a higher rate. Our policy is to have reserves covering funding for 6 to 9 months. We are just shy of this at 5.8 months, and we'll continue to manage our costs to get our reserves up above the 6-month mark. Thank you. Any questions?
Mr. Chairman, just with the reserve, projected reserve for FY26 does not include any surplus that may materialize out of the current year's budget. So again, as I think Holly indicated, we continuously find new ways to reduce our costs, become more efficient, as well as looking at grant money, and our investment income has been overperformed over the last several years. So we anticipate between those 3 areas of focus, we more likely will have a surplus to add to this. So at a minimum, we're going to be at this 20,209,000, but probably be higher than that. So we'll probably be at the 6-month. Again, that's a factor of the 2 numbers involved with the months of operating fund, next year's operating budget, as well as the amount of reserves we have. So if our costs keep going up, as it has been over the last several years, then so we should be able to get to 6 months. Stay close with it, maybe a little bit higher. So
okay. Yep. Thank you for that. I think first of all, thank you, Holly, and thank you to the Finance Committee for the work here. We need a vote here. So before I ask for that, any discussion or questions, particularly around the fiscal year 2026 first quarter budget report, because that's the subject of our vote. So any questions more generally about the budget? If not, I'd ask for a vote to approve the fiscal year 2026 quarter 1 budget as just presented to us. And if any discussion, if not, could I have a nomination to approve that first quarter budget?
Mr. Chair, this is Claudio.
Thank you, Claudio. Second?
Tom McNeil, second.
Thank you, Tom. Any follow-up discussion? If not, then Charles Clipple, yes.
Thank you. Paul Philpott,
Yes.
Grant Ritter,
Yes.
Deidre Gifford, Steve Hernandez, Matthew Brockman,
Yes.
Thomas McNeil,
Yes.
Dina Berlin,
Yes.
Andrea Barton Reeves, Kathleen Holt,
Yes.
and Claudio Galtieri.
Yes.
Thank you. Motion passes.
Terrific. Thank you all very much. Next, Susan Richpai to talk about the audits.
Thank you very much, Mr. Chair. Hello, everybody. Susan Richby, Director of Legal and Governmental Affairs. I have an update for you on several different audit items. So Access Health CT is required to engage an independent auditor each year to conduct a financial audit as well as a programmatic audit to comply with state and federal oversight and program integrity requirements. Whittlesley has been engaged as Access Health CT's current independent auditor, and they are with us here today for this meeting. Whittlesley completed the financial statements for Access Health for FY25, as well as the programmatic audit that's required by ACA regulations for a state-based marketplace. These draft reports were presented to the audit committee last week on November 13th, and the committee voted to recommend approval of both reports by the board today. And you should have received copies with your board packet. For both of the reports, Whittlesley was engaged to express an opinion as to whether the basic financial statements are presented fairly in accordance with accounting principles generally accepted in the United States of America, also referred to as GAAP, GAAP, report on internal control over financial statements and compliance with the provisions, laws, regulations, contracts, and grant agreements in accordance with government auditing standards, and report on compliance with the programmatic requirements set forth by CMS in accordance with Title 45 U.S. Code of Federal Regulations, Part 155, and that refers to exchanges. Whittlesley issued an unmodified opinion on the basic financial statements for FY25 and did not note any internal control findings. No compliance findings were issued for the programmatic procedures either. Under GAAP, an unmodified audit opinion represents the highest level of assurance an auditor can give, similarly to what was formerly known as a clean opinion. So this is very good news. With us today are Tom Goldfuss and Jean Callan from Whittlesley. So they are here if you have any questions on the two reports. So I will pause. Thank you.
Are there any questions? First of all, let me thank our external auditors for joining us today. So thank you all very much. And then echo Susan's question. Any questions or comments on the audits? It is great news. So thank you all very much. I appreciate that. Any other comments before we take a vote to approve these audited financial statements? If not, then I would ask for a vote to approve the fiscal year 2025 audited financial statements as they've been presented to us.
Hi,
Any
this is
comments?
Grant. So moved.
Well, thank you, Paul. Grant?
Seconded. Yeah.
Thank you very much. I appreciate that. Any further discussion? If not, Charles Clipple, yes.
Thank you. Paul Philpott,
Yes.
Grant Ritter,
Yes.
Deidre Gifford, Steve Hernandez, Matthew Brockman,
Yes.
Thomas McNeil,
Yes.
Dina Berlin,
Yes.
Andrea Barton Reeves, Kathleen Holt,
Yes.
and Claudio Galtieri.
Yes.
Thank you. Motion passes.
Thank you very much. And then a second vote for approval of the fiscal year 2025 programmatic audit as it's been presented to us. Could I have a motion to approve that audit?
Hi, this is Grant. So moved.
Thanks, Grant. Second?
Kathy Holt,
Can I-
second.
Thank you, Kathy, very much. Any comments, questions? If not, Charlie Clipple, yes.
Thank you. Paul Philpott,
Yes.
Grant Ritter,
Yes.
Deidre Gifford, Steven Hernandez, Matthew Brockman,
Yes.
Mr. Thomas McNeil,
Yes.
Dina Berlin,
Yes.
Andrea Barton Reeves, Kathleen Holt,
Yes.
and Claudio Gualtieri.
Yes.
Thank you. Motion passes.
Thank you all. And again, thank you for our auditors for joining us today. I think the floor is still yours, Susan.
Yes, I have one more short item. Thank you. The state-based marketplace annual reporting tool, also referred to as the SMART. The ACA requires state-based marketplaces to keep accurate accounting of all of our activities, receipts, and expenditures, and to monitor and report to the U.S. Department of Health and Human Services on our exchange-related activities, as well as complete an annual report and engage an independent auditor, as we've talked about today, to perform the independent financial and programmatic audits to ensure our compliance with regulations and standards. Many years ago, CMS developed an online reporting tool, the SMART, for state exchanges to use to put this all into one easy place. The SMART includes eligibility and enrollment policy, a report by the SBM on its ability to collect and submit standardized performance monitoring data related to the qualified health plans, and the APTCs and CSR eligibility determinations, the financial assistance eligibility determinations, enrollments, disenrollments, as well as special enrollment periods. And then also the financial and programmatic audits and program integrity requirements. And finally, you finish with an attestation of completion. As James mentioned earlier, we filed our SMART. This is done on a calendar year, by the way, as opposed to our fiscal year. We filed our SMART for plan year 2024 on time on May 30th, and CMS is a little behind schedule issuing the final SMART letters due to the shutdown, but we anticipate receiving our letter in the next week or so, and we do not anticipate any action items for this SMART filing. So I will pause if there are any questions.
Sounds good. It sounds,
Thank you.
these really are terrific audit results. So thank you all very much. Thanks to the management team behind all this as well. Next, the open enrollment update. Katie Hearn.
Thank you, Mr. Chair. Good morning, members of the board. Katie Hearn, Associate Director of the EPMO. I have a brief open enrollment status update for you today, starting with some call center IVR enhancements. Our call center and operations department have worked hard to implement enhancements to the call center's interactive voice response system, or IVR. During this year's open enrollment, callers can now interact with the IVR using speech for the first time. In addition to English and Spanish, additional language options were added, including Portuguese, Haitian Creole, Ukrainian, and Arabic. Callers seeking information on a particular topic can now benefit from a new text a link feature, enabling callers to receive helpful articles from our website via text message. We also have a new auto authentication feature, which allows consumers with an existing application to verify their identity within the IVR before speaking with an agent. This securely collects and validates caller authentication data in advance of speaking with an agent, enabling the call center agents to address consumer needs more quickly and efficiently. Next slide, please. Moving on to enrollment information, our projection notices were successfully sent out in the month of October. Auto renewals and auto renewal notifications are in progress. They began this week and will continue through November 25th. And just as a reminder, our public enrollment dashboard is on the Access Health Connecticut website and is updated weekly. You may recognize this chart. We do expect to see a drop in auto renewals this year to 73%, or 82,276 individuals, down from a historical auto renewal average of 86%. This is due to the 400% CLIF population no longer being eligible for enhanced premium tax credits and others who no longer qualify for advanced premium tax credits. This table shows enrollment numbers as of October 15th. And our projected enrollment numbers at the expected end of open enrollment on January 15th. The Cover Connecticut numbers are expected to increase at a normal rate of growth as there continues to be no cost to the consumer for Cover Connecticut. And this table was shared in a recent board memo. Next slide, please. Just for some context of where we began before the start of open enrollment this year, this slide shows that we have higher enrollment numbers at the start of this OE as compared with last OE. Total qualified health plan enrollments for the 24 policy year prior to OE were 138,860, and our total qualified health plan enrollments for 25 prior to OE were at 159,646. And finally, I wanted to share some recent enrollment numbers with you. There's no slide for this, but these are enrollment numbers as of yesterday. And again, we're in the middle of our auto renewal cycle, so these will start ticking up quickly. But as of yesterday, all qualified health plan enrollments for the 26 policy year so far are at 28,221. Within that figure, qualified health plan enrollments without financial help, we're at 5,421. Qualified health plan enrollments with financial help, excluding Covered Connecticut, we're at 13,848. And Covered Connecticut health plan enrollments alone, we're at 8,952. Our dental enrollment plans were at 4,460 as of yesterday. We will provide you with a year-over-year enrollment numbers comparison when the auto renewal cycle concludes. It's expected again to conclude November 25th. We'll continue to provide updated enrollment figures throughout OE. Thank you. I can pause here.
Thank you very much for the update. Any questions or comments? If not, then thank you again. And we will move back to Susan for an ACA update.
Thank you very much. So we, as James mentioned, there's been a lot of discussion and activity going on down in Washington, D.C., and also at the state level. So we wanted to just touch on a number of these items for you today. There is a potential vote in the Senate on the extension of the enhanced premium tax credits in December. That was part of a deal that was negotiated for the votes to end the shutdown recently. The discussions include, as we've been learning, either a straight extension using the current structure or an extension with the new cap on EP enhanced premium tax credit eligibility at 600% of the federal poverty level, perhaps, or some other set income amount, a dollar amount. Another item they've been talking about is new penalties for broker fraud. That is a big issue that a number of people and members of Congress are concerned about, and also creation of a new consent verification process for new enrollments and coverage changes, which also ties to the broker fraud. And I will point out, and I think we've talked about this before, this was not an issue for Access Health and in the state exchanges. It really was more of an issue in the FFM. Also, the House Democrats have been talking about this. There is discussion of them joining together for a 3-year extension through a discharge petition. And a discharge petition is a way for the members to force a vote when leadership is not calling for a vote on something. They have to get 218 signatures. I don't know exactly where they are, but I think they would need 3 or 4 Republicans to join all the Democrats for that. And at this point, there's no guarantee of a vote in the House has been made by Speaker Johnson versus the guarantee in the Senate. If you go to the next slide, please, Martin. Additional items that have been raised and floated around by the Trump administration, and you may have read about these. Some of these, there is a proposed public charge rule change that is currently under review. For folks that were with us during the first Trump administration, public charge was a big issue. It went away after the Biden administration took over. The regs were changed. There is a move underfoot, by the Trump administration now to make some changes and possibly bring that back. They've also been discussing providing funding directly to consumers instead of through the enhanced premium tax credits to be used to cover health expenses through either health savings or flexible spending accounts. You can use those accounts for different things. And also, there are renewed discussions about consideration for federal funding for the cost sharing reductions, which would end or change silver loading. We've talked about this over the years. Once the federal government stopped funding the cost sharing reductions in 2018, states turned to silver loading. Connecticut is one of those states to make up the difference for carriers for that cost for the cost sharing reductions, which has actually raised silver premiums, which raised subsidies as they're pegged to the second lowest silver. So if there was a change to this, it would actually reduce silver premiums, which would also reduce premium tax credits. So this was something they were talking about earlier in the summer in the One Big Beautiful Bill Act, and many stakeholders put in their opinions that as rates were already submitted for 2026, that this, it was too late in the cycle. But I'm sure they are going to continue looking at this, for 2027 or future years. And then just on the state level, the state legislature did go into special session, as I'm sure everyone is aware recently. And one of the items that was passed was House Bill 8003, which created a $500 million reserve fund that the state can use to fill gaps in a number of items, including federal food assistance programs, the low-income home energy assistance program, as well as healthcare programs, which could be the exchange, could be Medicaid, could be a number of items. So those are all things that have taken place in recent weeks, and we'll keep our eyes on everything and keep you up to date. Thank you. I'll pause for any questions.
Thank you, Susan. Your updates are always great. I really appreciate it. Any questions or comments? All right. Again, thank you so much for bringing us up to date and for keeping us up to date in the future. We appreciate it. James?
Very quickly, Mr. Chairman, right now we are focused on the immediate future. We're looking at make sure we are prepared for the changes that will be happening in DC, and so we could pivot and to make sure the minimal disruption to our customers' experience. So we have a plan. We're ready to go. We're just waiting to see which direction do we go based on what the Congress and President do, and hopefully within the next couple of weeks, several weeks. So we look forward to that challenge. But in the future, we are looking at 10 Clicks. That project is up and running. We got RFPs have come in. We have an internal committee that's reviewing the RFP for the 10 Clicks, and we hope to make an award sometime late winter or early spring. And we work to start designing and building our new system sometime in early spring. So we'll keep the strategy committee and the board abreast of where we are going forward. And Mr. Chairman, I know we have another 10 minutes left. I do want to extend my thanks and appreciation to the board and our entire staff. I think earlier you complimented the board, our leadership team for doing excellent work with respect to making our budgets, making sure our audits are in line. Obviously, the last 6 months has been extraordinarily uncertain. And I think the resiliency of this organization, going from with the board and to our entry-level employees and everybody in between, shows how strong and resilient we are as an organization with respect to our ability to shift when we need to make sure our customers, Connecticut residents, continue to have access to affordable, quality health insurance. So I want to extend my thanks and appreciation to the board and also to our staff for giving us the resiliency that we need and will continue to need to address what's going on, the uncertainty, the unknown future that we operate in. Thank you. And I also wish everybody a Merry Thanksgiving, and we will see you next year because we don't have a board meeting in December.
James, thank you very much. I'll take the privilege of extending the same congratulations to the team on behalf of the board. I think this has really been a challenging year, particularly the last half, and the results that you've shown us today, both in terms of budget accuracy and audit accuracy, really impressive. So thank you all very much on all of our behalves. Any other questions, comments, or agenda items to bring forward for this meeting?
Mr. Chair, if sorry to delay the adjournment, but when we talk about 13 clicks, I think it would be helpful if we can understand how that's going to intersect with new Medicaid eligibility determination and the work requirement. Is it envisioned that this will be helpful, or how will it be interoperable with the co-occurring work that's going to have to happen at DSS? I'm always looking for efficiencies of scale, and I think that would be a helpful part of the presentation when we talk about that.
It is part of the conversation, Claudio, and DSS is part of the steering committee. So everything that we are doing, that DSS needs for us to do, that we can do, will be incorporated into 10 Clicks. As you know, the 10 Clicks project is entirely, right now, is being paid for through assessment dollars, and we are forbidden from using assessment dollars to do anything for Medicaid. So we gotta work through that very carefully. But DSS has 3 members of their team in our steering committee to make sure DSS needs are addressed. So that is part of the plan. But to your question point, and we are working very closely with the strategy committee where we presented them the entire plan. So we will send the plan to the board, and discussing with Charlie about having a workshop sometime in the near future where we could walk through very detailed plans with respect to exactly what we're doing, how it's going to benefit all Connecticut residents, both QHP and Medicaid.
I think that workshop would really be helpful. You're now far enough along this project so that we can really get a chance to see it. And Claudio, again, another great question. So thank you. Any other comments, questions? If not, then first I'm going to add my best wishes for the holidays to all of you, and thank you for your continued diligence on this board, and then ask for a motion to adjourn the meeting.
Hi, this is Grant. Motion to adjourn.
Hey, thank you, Grant. Second?
Tom McNeil, second.
Thank you, Tom. Any discussion or questions? If not, Charlie Klippel, yes.
Thank you. Paul Philpott.
Yes.
Grant Rader.
Yes.
Peter Gifford. Steven Hernandez. Matthew Brockman.
Yes.
Thomas McNeil.
Yes.
Dina Berlin.
Yes.
Andrea Barton Reeves. Daphne Holt.
Yes.
And Claudio Voltieri.
Yes.
Thank you. Motion passes.
Well done. Thank you, everyone.
Thank you all.
Thanks, everybody.
Thank
Bye-bye
you.
now.